trachea there. So anything below the trachea, below the broken line, is what we call the lower respiratory tract. Anything above that is upper respiratory tract. Now, in the upper respiratory tract, that's actually under normal condition, there's this we include, I should say, include, I usually include in the upper respiratory tract the sinuses, paranasal sinuses and the middle ear, and also including some other airway sites. But the point I want to make is in the upper airway or upper respiratory tract, there are many, many bacteria and even yeast organisms. They are normal, or at least they are non-pathogenic. They do not cause disease. So in your mouth, in your throat, and you actually have lots of bacteria. Not only they will not cause, they are actually your friends. You know that, young people? So these bacteria are your good friends. They actually protect you, all right? Now remember this point, because later on we will apply this information. In the lower respiratory tract, meaning bronchi and the lungs, it's sterile. By sterile, I simply mean there's no living organism, no living microorganisms. In the lower respiratory tract, there are actually microorganisms there. But they are not living, simply because we have strong host defense mechanism. As soon as a microorganism gets to the lower respiratory tract, it will be destroyed by the phagocytes we call macrophages, and by other mechanisms as well. Now I want to introduce to you a concept that I have used in my teaching. This is called the triangle of infection. Triangle of infection, all right? By this, I simply mean that we need to look into three aspects when we think of infection. But first, let me define infection. The textbook definition of infection is simply invasion of the body by microorganisms. Invasion of the body by microorganisms. Now I want to make some strange statement, okay? The first statement I'm going to make is, I'm a microbiologist, incidentally, all right? So I study microorganisms for my living. One of the things I study for my living. So I'm going to make a strange statement. Microorganisms do not cause infections. So I'm saying something is actually against the textbook definition of infection. All right, some of you seem to be a bit uncomfortable. So let me modify my statement a little bit. Microbes or microorganisms alone do not cause infection. All right? Some of you say, I study microbiology, I studied bacteriology before. Nobody said that kind of thing. All right? So you're a little bit uncomfortable still. So let me modify some more. Microbes alone do not usually cause infections. Do not usually cause infection. I hope by now you're a little bit more comfortable with that statement. If not, let me explain to you. When we see infection, we talk about triangles of infection. So we need to look at three angles. Microorganism is only one of the three angles there. A few minutes ago, we mentioned that in our upper respiratory tract, there are friendly microorganisms, friendly bacteria, friendly yeast organisms in our body. So sometimes it's going to be difficult to know when we see a microbe whether it's a friend or enemies. I will say, with many, many microorganisms in our environment, in our body, majority of them happen to be friendly. Only small portion will be the enemy. So microbes alone does not cause the infection. We need to look into the person. The person is the host now. We need to look into the lifestyle of the person, the nutritional status of the person, the immune status of the person. Microorganisms alone, I mentioned, do not usually cause infection. It needs a susceptible person or susceptible host. By susceptible host, I mean a person's nutrition or immune status is somehow impaired. Then microorganisms will have a chance to invade our body. So even, let's say, the person is become susceptible, often we still do not have infection. So we will need to look at the third angle. I call it the predisposing factors. Predisposing factors, let's say if a person has a trauma, the skin is being cut, so if you have some bacteria there, of course, bacteria will have a chance to invade the tissue to cause infection. Or toxic exposure, or even stress, or a person has a certain underlying type of disease. So what I'm trying to say is, in order for infection to take place, we need microorganisms, but we also need to have a susceptible host. Also, we need to have a predisposing factor. Just microorganisms alone, you do not have infection. Even you have a susceptible individual and microorganism, you may still not have infection. So we need to look at all three factors here: microbes, host factor, and predisposing factors. Now, why do I go into so much? Our conventional thinking is if a person has an infection, I will give them the drug, antibiotics, right? I will give the antibiotics and kill those germs. Sometimes it works. Most of the time, it doesn't work very well. So I teach my students, although by the time they graduate from medical school, usually do not remember what I taught. But that's okay. Whenever I have a chance, I will still remind them. I said when you see an infection, and you need to look into if the host factor there can be improved. You need to look into the predisposing factor if that can be eliminated. If you see all these different angles, then you can really treat the patient, make the patient well. So infections, we need to look at the triangles of the infection. There are three factors. Having said that, let's come back to the problem with the respiratory infection, particularly in terms of cold, common colds, and flu, because the flu season is coming. And there's going to be a lot of publicity about the coming epidemics of flu. Drug company has spent a lot of money. A government has invested a lot of money to make that H1N1 flu vaccine, all right? They didn't use it out last year. So they're going to use it this year now, all right? In fact, the publicity will be created in such a way. There is a shortage. Rush to get the flu vaccine now. Because if you don't rush, you may not get it. Don't worry. You can wait for a little while. If they don't have it, let me know. I will ask the drug company to send some more to her. Of course, they won't listen to me, so that's okay. All right. I want to consider with you 5 clinical entities. Common cold, all right? Pharyngitis, also sore throat, Croup, acute epiglottitis, and acute sinusitis, and otitis media, or middle ear infection. Trachobronchitis and pneumonia, all right? Common cold. How many of you have not had common cold in your lifetime? Nobody. How many of you had common colds in your lifetime? All right? Okay, so you're not too much different from me. I have it too, so we're all together. You all know the signs and symptoms. Sneezing, runny nose, watering eyes, and just plain miserable. Kira, have you? Yes. What's the first sign of your cold? What's the first sign of your cold? Sneezing. Sneezing. And Kira has a good way. When she has sneezing, she will rush to our home. She even knows which drawer to open it up to get her natural remedies. Now let's look at the type of microorganisms cause these symptoms. Not bacteria. Virus